Hello, welcome to our Strong Retirement Club Health and Long-Term Care as You Age. So we ran through the webinar, but I forgot to record it. So now we're going to go back through it just for you, for those of you who missed it. Okay, so Kat Secor, she's our guest speaker for tonight, but she is sick. She is going to be part of our event next month. But just to give you an idea of what she's going to touch on, Kat is an amazing health and fitness coach. And she focuses, her demographic is people, women in their 50s and 60s, when their life starts changing, their health needs start changing, and how do they find a way to, as she says, maintain their mobility, maintain their independence, what does preventative care look like, what should I be doing, and really to take back control over their body. Because we don't want our aches and pains to stop us from doing all these things we've been waiting so long to do, things on our bucket list. And what's really important is, as she says, the moment we think that we should slow down is really the moment we should up it. And the more we can do, I see weightlifting is one thing that women start to give up as they get older, but it's so important to keep that bone density, to keep our bones strong so that we don't have to deal with these injuries, these surgeries later in life. Okay? So it's just a little bit of Kat. We'll go more into that later. Here we go. So I want to begin with what are our stages of retirement. So remember, retirement is a lifetime. So first up, we have the honeymoon, which is going to be your most active time of your life. Most active time in your retirement. You're going to be traveling, hiking, doing all sorts of things. Almost every woman says they want to focus on their health again in retirement. So what does that look like? How do we do that? How do we make our health a priority? Like what Kat will talk about. In the honeymoon stage, in regards to health and healthcare costs, we have pre-Medicare, and we're going to talk about what that looks like, and then enrolling into Medicare and post-Medicare. Next up, we have the relaxation stage. You start to slow down. You probably are still traveling, but really you're spending time with your loved ones. You are doing trips, traveling. They might not be the weeks, months-long trips to Europe, overseas, all these big excursions. Okay. What we see a lot in the relaxation stage, you're on Medicare, that's cruising along, but we see a lot of the unexpected injuries. Knee hip replacements, herniated discs, back surgeries, sometimes strokes, heart attacks, those type of things. And what's key is that when those happen, that we get taken out of our routines. And I've seen this happen with a few women that I work with, even the most active social people, always exercising, but they have a surgery, an injury, and it takes them out of that routine, and they start to feel alone. They start to feel isolated. And that's when they start to get depressed. And if you don't have a plan on staying socially engaged, connected, and mentally challenged, you're not going to bounce back, or you're not going to bounce back very easily. And that's why it's so important to have a plan, an idea, to know what I'm getting into, how can I make the most of it, and how do I make my recovery as quick as I can so I can bounce back. And you probably have seen it where you see somebody and go, ever since their knee surgery, they were never the same. Ever since their back surgery, they were never the same. That's what I don't want for you. The other thing in the relaxation stage, we see our dental costs. This is usually when people start to do their teeth, and it's a few thousand a tooth, so it can get pretty expensive. The reflection stage. So this is a time in retirement when our health starts to decline, right? Our priorities really shift, and we start thinking about, what type of impact have I had on this world? How do I leave a legacy? How do I give back as much as I can, whether it's my knowledge, experience, my stories, my traditions, my money values is a really important one. And this is usually when we need extra care. And understanding, do I want to start at home with extra care? Do I want to go into a nursing home, a continuous care facility? What does that all look like? What are the costs? And how do I make that process as seamless as I can. I'm sure all of you have had somebody in your life, a relative, friend, somebody who needed long-term care. And can you think about what I was thinking about? How can you make that transition easier for you? Not just for you, but for your loved ones who are going to be there helping you, navigating it, directing it. Okay? So let's go back, skip the slide, to pre-Medicare. Okay, so what does it look like before you hit 65 and you want to retire and you don't have health insurance anymore? What does it look like? Well, health insurance bases their premiums on age, geography, family composition, and tobacco use. Okay? It's usually going to be $800 to $1,000 a month per person pre-Medicare. So a lot of people come to me and they go, okay, as they come up to retirement, their priorities start to shift. And it's really, you're trading time for money. And there usually comes to a point where they're sick of trading time for money. They prioritize their time first. So they'll look at, is it worth it for me to stay at the job until 65, or do I want my time? Or maybe I'm going to have a part-time job just to cover those health care insurance premiums, just to cover that $1,000 a month. Maybe I'll do that so that I have more flexibility with my schedule. I can travel more. I have less stress in my life. Okay, so this is a quote for a 6-year-old, income in between $25,000 and $50,000. So for Cigna, it says $240 per month with an annual deductible of $4,400. First Health says $410, no in-network, no deductible. Okay, so a little bit more. Now these are for people with a very low income. Now what counts towards your income? Well, if Social Security will count towards it. Any withdrawals from a retirement plan will count towards your income. So this is very cheap coverage. Usually people, as I said before, that I work with, they're looking at in between $800 and $1,000 a month pre-Medicare. You can go to healthcare.gov to kind of get more information based on your demographic. Then there's Medicare enrollment. So what does that mean? So once you turn, the year you turn 65, you should start thinking about Medicare. There's a Medicare enrollment window. It's 3 months prior to the month you turn 65, the month you turn 65, and then 3 months after you turn 65. So it's a 7-month period for you to enroll. Now what happens if you wake up one day and you're way past that enrollment period? Well, there's a penalty. Okay? It can be up to 10% for every 12-month period when you are eligible for Medicare but don't enroll. So if you are 65 and you aren't working, you need to enroll in that window. If you are 65 but you're still working and you're covered by your company's health insurance plan, you don't have to enroll. They might want you to enroll in Part A because it's free and lower their costs, but you're not susceptible to that penalty. Now, once you retire, then you need to enroll. You have that window again. Now, if you're already taking Social Security, you're automatically enrolled in Medicare. The premium comes right out of your Social Security check. They make it simple because they want their money. Okay, so these are our cost assumptions with Medicare and what they look like. Okay, so cost assumptions. These are what we put into our projections when we project out somebody's retirement. Okay, so Part A is free, and we'll go into what each part is covered. Part B is about $1,600 per year. Part B is going to be a Medigap policy or supplemental policy. So that's going to, I'm sorry, Part B is not. That's the Medigap part. Part B is hospital visits, and it's usually $100 to $150 a month, depending on your income. And that depends on your income the year before you get onto Medicare. Enroll in Medicare. Okay, so if you leave your job right before you enroll in Medicare, you're going to have a higher income than other years. Medigap's usually a few hundred a month. And then usually there's out-of-pocket. Eye, dental costs, drugs, those type of stuff. So what we project out is about $5,000 a year per person just for medical costs. Healthcare inflation is 5%, so those costs go up a lot quicker than the typical inflation. The average couple will spend $280,000 in healthcare costs. The man lives to 87 and the woman to 89. $280,000. So Part A. Part A for Medicare or hospital care, limited nursing facility care, hospice care, limited home health care. It's financed by our payroll taxes. So Part A is free. Part B is the one that you have to pay, that premium about $100, $150 a month. This covers the cost of doctor bills, outpatient emergency room services, ambulance, diagnostic tests, all those things. And it's financed using tax revenues and the premiums that you're paying into it. Okay. Part C. So this is where you have a choice. Right? You can do a Medigap policy or a supplemental. Medigap policies were very similar to HMO policies, right? You have to use it in network people. If you want more flexibility or if you have a lot of specialty doctors, it's probably worth it to do a supplemental. Okay? And really the difference comes to Medigap policies, you're paying less each month, but your deductible is a lot higher. Right? Your out-of-pocket is going to be a lot higher. Supplemental, you're paying more each month with a lower out-of-pocket for things. Okay. So here's another really good website. You'll get all these websites, don't worry. Here's another good website to see what type of policies is better for me based on the doctors I currently see, the drugs I'm on, that type of stuff. And also your history of health. And then D is the drug. D stands for drug. What's interesting is that each year, Medicare partners up with a different pharmacy. So it's always good. There's open enrollment periods, right, from January to March, that you can change your drug plan to see, okay, based on the drugs I'm on and the pharmacies, what's the best drug plan for me? And it usually will save you a few $100s. Next up, long-term care. I know we never want to think about being in a nursing home in a wheelchair playing bingo, listening to Frank Sinatra, imitator, for hours on end. But as I used to tell my grandmother, I'm like, Nana, this is like a college. You have happy hour, you have games, you're social, you go to the cafeteria, right? They have the whole dining room. And I'm like, this is great. You have your dorm rooms, all that stuff. So long-term care, what is it? Well, it's when you can't perform the activities of daily living, right? Eating, bathing, dressing, using the restroom, and moving from place to place. Or cognitive impairment, dementia, Alzheimer's, right? It's the treatment of medical conditions provided by a licensed professional like nurses, therapists, physicians. And you can start long-term care at the home, in a community, assisted living, or nursing home. Okay. So these are the average costs. Okay, these are the average costs for the U.S. New Jersey, sorry to say, a lot more expensive. But you could always go to the PA, it's a lot cheaper. South Jersey is a lot cheaper. But here, so adult daycare is about $18,000 a year. Assisted living, $45,000 a year. A private nursing home, about $97,000 a year. In Somerset County, New Jersey, it is about $10,000 to $12,000 a year. I'll let that sink in. $10,000 to $12,000. I'm sorry, a month. So over $120,000 a year going to your long-term care costs. Do you have enough to cover 1 year of that? Do you have enough to cover 2 years of that? What about 3 years of that? Are the odds on your side? Unfortunately, they are not. So there's a 58% chance of needing long-term care for an average of 2 years. A 15% chance you will need 2 to 5 years. 1 in 7 adults will need for 5 or more years. So why utilize insurance? So these are the reasons I hear people say, well, they don't want to just put this burden on their family. They want to be able to protect the risk of needing long-term care and not put that risk on their family. Because that really is when we don't plan for long-term care, we're transferring that risk from ourselves to our family. Do you want to transfer that risk from yourself to your family? It'll protect family finances. So what does that mean? Well, we'll go into it. If you decide not to plan for it, you basically have to self-pay for it until you spend through all of your money, and then you go into Medicaid. Well, if you have a spouse, you want to make sure you leave your spouse with enough money to live. If you have children, you might want to make sure you leave your children money, leave a legacy, and so on. So it protects your family finances. Avoids effects of potentially higher taxes. So when you have a long-term care policy, the benefits get paid tax-free out. So it's a very tax-efficient vehicle. It provides liquidity, so it's a way to have something that's going to fund your long-term care needs without having to go into your cash flow or your assets to pay for it. Right? You have accessible money that's there just to pay for long-term care. And it gives you security. It gives you a sense of security. How do you pay? Well, Medicare really won't pay for it. The condition needs to be improving for them to pay for it, and they're only going to pay for very, very limited time, a few weeks. Medicaid will pay for it. Great. Okay, oh no, but you have to be broke. You can only have $2,000 in your name. Okay? Now, if you have a spouse is able to keep about $150,000 in their name. Which, you think about it, really isn't much money. We have a woman, she came to us after her spouse passed away. He had dementia for about 15 years, and they had to she couldn't keep up with the costs of the care, the extra care of the nursing home, so she had to go into her assets. So she got even her own retirement money when she got it down to the $150,000 mark. But by the time they got onto Medicaid, because that's the whole process, it is now $100,000. So now she's in her 70s, retiring, and she only has $100,000 to her name. So people are like, okay, well, why don't I just get assets out of my name? I can move my house out of my name. I can move my bank accounts, my investment accounts out of my name. I'll just gift it, I'm saying gift in quotes, to family, to my kids, to a trust, just to get it out of my name so I can go on Medicaid. Well, Medicaid got smart, and they started doing a look-back period. It was 3 years. Now it's 5 years, and they're saying, well, we're going to go back and see if you gifted assets within 5 years. If you have gifted assets within 5 years, we're basically going to assume you still have that assets, and you're on the hook to pay until those assets are depleted. Okay. What are other ways to pay? You can get a traditional long-term care policy that will pay $100 a day, $300, $400, $500 a day for 1 year, 2 year, 3 year, 5 year periods. Okay. And once you can perform 2 or more of the activities of daily living, they'll provide benefits to you. Okay, great. Sign me up for that. Well, there are some cons to them. They are expensive, so sometimes financially they just don't make sense for people. And the premiums can and do go up each year. Right? The problem with long-term care insurance policies are it's a very new product, and the insurance companies misprice them. So now, almost every year, they apply to the state to say, I need to raise the premiums because they're not covering our costs. Long-term care insurance policies are very similar to disability policies. While you're working, your greatest asset is your ability to earn a wage. So we buy disability coverage to protect that in case we can't do our job, but we still have bills to pay. Long-term care insurance protects retirees' greatest assets, their actual assets, their retirement accounts, their investments, their house equity. Just like disability, if during my career I don't become disabled, well, I paid premiums this whole time for something I didn't use. Right? I bought it to protect a risk, a big risk. Same thing with long-term care. If you go through retirement and you never need long-term care, well, you paid all these premiums and you weren't able to get any of the benefits from. Which I still think should be a win because you never had to go into a nursing home. But the industry got creative, and now we have different alternatives, which Georgette and I are actually going into in a week to talk about these things, so we'll have some actual case info for you, too. So one is a life insurance long-term care combo. So what that means is it's a life insurance policy. So if you never need long-term care, you'll still get the death benefit, or your heirs will get the death benefit. So there's a 100% chance you're going to die, so somebody will get the benefit. But if you need long-term care before then, it will pay you a percentage of that death benefit up front. So say it's a $500,000 death benefit, you need $200,000 of long-term care to cover the cost. It'll pay you that out, a percentage of it each month to cover your costs. And it's usually tax-free. There's also annuity long-term care combos. So if you need extra care, they'll increase the payment. There's one that's going to triple the amount that you put into the annuity if you need long-term care. Okay. And again, that income isn't taxable, usually. You can self-insure, you can pay for it yourself, or you can ask someone to pay for you. The biggest thing is having a plan in place leaves you less vulnerable. And I shared a story about my uncle who is 71 or 72. Great shape, always very healthy, phenomenal runner. I mean, he had the record for the New Jersey Mile when he was in high school. It was like under 4 minutes. It was insane. But my aunt found him on the floor one day in the kitchen with his skull bleeding. He was in a coma for 4 weeks. We really didn't think he was going to come out of it at all. He did come out of it, but he has severe dementia. So him and my aunt have been married for about 20 years. And he thinks that they're engaged to be married, and he doesn't know if he wants to go through with it or not. So that's how many years of memory is missing. And he gets very volatile. He gets very angry and frustrated. And so they're having a lot of trouble finding a place for him to go. And it's extremely sad to see. But they had nothing in place. They didn't even have wills. They didn't have power of attorney. It doesn't matter how much my father tried to tell them to do it. They never did it because they thought it will never happen to me. I'm still young. I'm still in shape. It won't happen to me. It left them extremely vulnerable. Now all the money is going to be spent, and my aunt is going to be broke. And there'll be nothing left to go to his sons. And it's just a very, very sad situation. And I share that not to be a bummer, but because these things do happen. As much as we don't want them to, they do happen. So let's plan for it so we don't pass that risk to our family, our loved ones. So how do we be proactive? So I am huge on having a team of support. I have a team of support for me. I have a team of support for my business. I have a team of support for you ladies, who I'm going to share with you. But there are so many professionals out there ready to help. People who will pay your bills, make sure your bills are paid. Attorneys, organizers, accountants. A lot of nursing homes or continuous care facilities, you can prepay. So you put down a deposit of a few $100,000, and usually that means your monthly payment is a lot less. And it's really about how do we best use your assets? How do we plan for your assets? And lastly, what happens to your belongings? And this is where Crystal Dawn, who's a club member, she can share her business because her business deals exactly with this. So resources. So these are some amazing websites that you can utilize and go to. Pre-Medicare, healthcare.gov. Medicare enrollment period, so you know what is your window so you don't miss it. Medigap plans, so Medigap versus supplemental plans. And professionals, build your team. So Coach Kat, she's now a strategic partner with our club. So we're going to talk more about how you can right now you get a bonus free discovery call with her, a 20-30 minute call. But if you want a longer one-on-one full hour strategy session with her so you have some tangible, some takeaways that you can start implementing and what to think about with your health now and as you age, as you mature through retirement, she is awesome. So we're going to talk more about that. Chris Ladon, who I talked about before, has an amazing website, new business. She can really help you make sure your photos, letters, recipes, traditions, anything that you hold really near and dear to your heart, that they don't get lost in the shuffle. Okay? A big thing, because I have an organizer down. How cool is it? How cool would it be if you start to need extra care and you have this whole plan laid out, right? I have Chris Ladon help me with my memories. They're all in check. They're not going to get lost in my transition to the nursing home or continuous care facility. I have an organizer, so you tell your loved ones, all you have to do, I already paid her or she already has her retainer. She's going to come in and organize everything, pack up my house. You don't have to touch a thing. That's amazing. Your loved ones will cherish you forever. Stephanie Heller does bill pay. She helps me with my own company, bill pay. She's amazing. If your memory starts to go, to make sure you don't pay your electric bill 3 times and yet forget your gas bill. Or maybe you like to travel and you just don't want that headache anymore. Linda Engleby is an amazing estate attorney. Christine and I went together to see her to get her will, power of attorney. We created a living trust for her, all these different things. So it was really, she's a great person to have on your team or somebody like her so that you know who is your go-to person if you need help making decisions. If you don't have somebody, we can have a trust company, which is what Christine did, add a trust company to it so that it's not just a relative or a friend or somebody that you're putting that burden on. It's actually a whole company, a whole team behind it, and they do this day in, day out. And Darlene's a great accountant, but we also have Megan who does free one-on-one consultations for your taxes. She's awesome. If you want to look at more about, how much am I going to be paying in taxes in retirement? What does that look like? Or making sure you're doing your taxes right. You're not taking on too many liabilities or risks with them. Okay, so I did kind of cruise through this because I forgot to record it earlier. Please write down any notes or questions in them. Put them in the chat or bring them with you to our live event next week. Bring them to our one-on-one sessions. This is a lot of content that I went through very quickly. During our live event, you're going to get a workbook where each stage of retirement, we're going to look at the numbers, right? What are my costs going to be for healthcare? What's my plan? What is my next step? During the honeymoon stage, the first step really is about talking with your family. I have this plan. These are the pieces that they need to know about. During the relaxation stage, this is when we really need to plan for long-term care stuff. Am I starting to move assets out of my name to protect them from Medicaid? Am I using long-term care insurance? What is it? How am I going to pay? What are the logistics of it? Right? How am I going to plan for it? How am I going to pay for it? What are the logistics? And the last reflection stage usually is when we start to need extra care. Am I going to stay at home first? Am I going to go to a continuous care facility? What does that look like? What do I want to happen with my house? Just sell it, rent it, keep it? Who's going to help pack it up? Who's going to move this stuff? Who's going to help with that transition so that I'm not just putting that on my family, loved ones, my friends? Okay? So that's why, to me, all of these little pieces are what gets overlooked. But like my uncle, it can happen so quickly. And that's when I see families struggling when it happens so unexpectedly. They get blindsided by it. They're in shock. And now they have to figure out all these things and do justice for you. Right? When we don't plan for it, we just pass that burden, that risk to our family. And I'm sure you don't want to put any more risks, any more stuff on your family. All right? So I'll see you in a month. Please let me know if you have questions. Pop in the chat, send me an email, whatever it is. All right. Thank you.